Welcome to Live with Hillsdale Hospital. Today is March 14th, a Friday. Glad to have you in the studio here with us today. I'm so excited. I have a few friends that are joining me today from the Michigan Hospital Association. We're going to talk about an issue right now that's garnering a lot of attention in the media, both local and statewide, as well as even national media because of some of the impact that this has in our nation with some funding. But we're here to provide you, our listeners, with up-to-date information on healthcare issues that impact you right here in our communities. And I am very excited to offer to you two of the most leading, I would say, gurus for me when I ever have an issue I have to identify issues in Lansing or Washington. These folks are my experts. This is who I go to and say, what should we be doing in this area? How should we frame this? Because our association is so important to the operation of our hospital. And just a side note, all Michigan hospitals belong to the Michigan Hospital Association, which is incredible for a state like ours to have 100% participation. What that means is that we trust the work that these individuals do for us every day. And there's many components of the MHA, many divisions of the MHA. We're talking with today are the folks that are working very closely with our political friends in Washington and in Lansing to talk about how do we continue to fund healthcare? How do we fund healthcare? What are the conversations around healthcare, access, funding, and the list goes on and on. So today, my special guest, Laura Appel and Adam Carlson, both from the Michigan Hospital Association. And it is a pleasure. I don't believe I've had both of you at the same time in the studio. So this is an honor. I've held both of you in my conferences here, either in our podcast or in the studio individually. But it's great to have you together because the teamwork that both of you do is remarkable. I've watched you over the years, and the ability to go in, identify a problem, and to break it down so that we all understand it more clearly and objectively. I appreciate the work that you've done. So Laura, let's start with you. You have been around the MHA for a hot minute, and certainly have had a lot of time in the world of Lansing and Washington. So why don't you give us a little backdrop about your experience and what you do at the MHA?
Sure. Thank you, JJ. And we're really pleased to have this opportunity to chat with you and your audience. My name is Laura. I am an executive vice president here at the Michigan Health and Hospital Association. On February 28th, I celebrated my 25th year being with the association, which that time seems to have just flown right by. Before that, I was with the Michigan legislature for more than 10 years. My current role here is to be responsible for all of the work that we do in advocacy, a nice way of saying lobbying, both at the state and federal level, policy, which is trying to figure out what our laws and regulations mean and how they're being implemented, communications, making sure that we're getting the word out, not only about what hospitals do and why they do it, but also to our hospitals to help them understand what's going on in the world around them. And finally, we have a finance division that helps hospitals understand what this means to them in terms of the dollars and cents, the finances, and what might be hurting them and helping them, etc. So thanks again for having us.
Absolutely, Laura. And just to speak about that, the work that your finance team does for hospitals like Hillsdale is incredible. You model, so decisions that are made in Lansing and Washington, you'll model what that means for communities like Hillsdale. What is the pickup? What is the loss in those programs? We're going to talk a little bit more about that today regarding the topic of Medicaid. But before we do that, Adam, if you do the same, please.
Thanks, JJ. Adam Carlson, Senior Vice President of Advocacy at the MHA. It's great to be back on the show. I've been with the MHA for about 7 years now, and prior to that, I worked for the state of Michigan in the budget office, so doing the ins and outs of the numbers here at the state level. And then before that, worked for the state legislature. And then, like so many of us who are into politics, spent a lot of time doing campaigns early in my career as well. So good to be here, JJ, and happy to talk about this.
Well, it's great to have you here, and we're just going to jump right in, folks, okay? Because the headlines across the country and in the states and now even trickling locally is the issue of Medicaid and Medicaid cuts. Now, I want to take just a few minutes to explain our position in terms of where we are as a hospital. 68% of my payers, the people that come in and use my hospital, 68% of those individuals receive some type of government health care, Medicaid or Medicare. And when you look at rural community populations, typically that's what you find, a higher incident rate of individuals that are on Medicaid. And you do see that, and that is across the country. And then you take the other government program, which is Medicare, and together those represent in communities like mine close to 70%. And we're no different than other communities around the area, around the state, and even across the nation. As our communities get older, what happens is the switch or the transition to Medicare. But what we often forget is that Medicare can also have a supplement. The supplement to Medicare can be Medicaid. So you can have an individual that's receiving Medicare who also gets the Medicaid product. So it's important to make that notion as we look at this issue for us as a hospital, for the viewership in Hillsborough County. But throughout the state and nation, as you're watching this, your communities and rural communities are going to see the same demographics. Now, we also say that, when we look at this issue, I often like to say healthcare is a nonpartisan issue. It should be. Whether Republican, Democrat, Independent. Now, what happens is it's the way it gets funded that turns partisan, right? The way it gets funded and the conversation about where should those dollars be, and in what area or environment should the funding come, whether it's reduction of Medicaid, reduction of Medicare, whatever it is, or even an increase by allowing the respective states to participate in certain tax allowances. Now, with that, as we look at it, we understand, and just correct me if I'm incorrect here, that Medicare has not been discussed to the degree that Medicaid has. Is that correct?
Adam, I think you might want to comment on that, because while we've been told that it's not on the table for the current budget resolution discussions at the federal level, I'm not sure that's entirely accurate.
Okay.
Yeah, when we talk to our Congress people, I think we're very concerned that while Medicare as a whole might not be under attack, there may be some pieces that we might have to address at some point. But I definitely think our biggest threat right now is on the Medicaid side.
Okay. Well, so I want to focus on that today, if we could. Let's talk maybe a little later.
It is the closest snake.
Yeah, it is.
When it comes to shooting snakes, that's the closest one, is the threat to Medicaid.
Yeah, and we're hearing more and more of that. In fact, just a quick search of any internet article will demonstrate that there is a tremendous amount of chatter right now. Interestingly, and I did pull up just a few of them, Politico is, I'm just giving a wide variety of news articles from the Washington Post to Politico. Politico says one of the statements is that even among Republicans, that over 60% oppose Medicaid cuts. And Kirsten is going to be putting that up on the screen for that link here. And you can search that out yourself. But interestingly, that 60% here, Republicans in Congress, individuals standing up saying, we're not going to support a particular bill if it has Medicaid cuts in it. And so why this has risen right now to conversation, it's always in the back burner, right, as we talk about funding, is because there was a proposal, there was a discussion, there was a recommendation to cut $880 billion from the Commerce budget. And let's talk a little bit about, that's what really prompted some of this dialogue. So Laura, if we want to start with you, because that's really what led us to believe, wait a minute, $880 billion cut out of a department that houses Medicaid, and Medicaid is a large portion of that. That's why the chatter began. So I want to talk a little bit about that if we could. So can you frame that for us about why it's on
Absolutely.
the list?
So Medicaid historically has been seen as a cost sector, something that we should try and avoid. Although, as you mentioned, 60% of folks are opposed to cuts in a recent poll. Many families have some relationship to using Medicaid as their coverage. Many people have elderly loved ones who use Medicaid for their nursing home care. More than 50% of the people giving birth, the women giving birth in Michigan, more than 50% of them have Medicaid for their coverage at the time that they're delivering their baby. So that makes a huge difference. Medicaid is the single largest payer in our state for mental health services. So if you need nursing home care, if you need labor and delivery services, you need to deliver a baby, or you need mental health services, there's a really good chance that Medicaid is supporting that care for your family. And it might not be, it might not be the grandparents, but it's their child who's having that baby. It might not be your grandmother who needs the nursing home, but it's your great aunt or somebody in your family. Medicaid is everywhere, and I think that there's been a lot of conversation about, well, we're not going to cut anyone off Medicaid. We're not, that's not what we're not really cutting Medicaid. There's this finance stuff that we want to go after, but we're not cutting Medicaid. And our position is that cutting funding is cutting care. There's just what do you think those dollars are used for? I mean, they're not put in a bank and held in escrow to, for future projects. They're paying for the services that people need right now.
Yeah. So Adam, let me follow up on what Laura just said. So that is what we're finding right now when we have these conversations is, oh, that's hysteria, JJ. They're never going to cut Medicaid. They're never going to cut Medicare as a program. And that would probably be a true statement. There's going to be some form of it. Tell us, Adam, why it's a concern. Yeah, the program's there, but your hospitals and your healthcare, places where you go, whether it's primary care, whether it's specialty care, independent or hospital owned, may not be there. And that's because of the way the reimbursement works, correct?
Absolutely. And to that point, you threw out the $880 billion number, and working on government budgets for a long time, we kind of get lost in the millions, the billions, the trillions, because they get thrown around so much. And what we're hearing from Congress is they say, yep, we're only going to cut out the waste, fraud, and abuse out of the system, right? And that's what they say, and that's what they're going to go after. And it's just using that terminology to mask real, true cuts that they want to make to the Medicaid program that's going to terminate coverage for people, right? Anybody can look this up. It's public information about the waste and fraud and abuse in the system. And there's some does exist. It's illegal. Congress should go after that right now. The true waste, those improper payments that are being made, that's illegal. They need to go after that and stamp that out. But the amount of money that is a result of those illegal payments is very small. So the rest of the money they're going to get is going to be direct cuts to providers. And these cuts are going to terminate coverage for people and have a real impact on communities, right? And so when you first started talking, JJ, you talked about how healthcare is not political, right? It's not political whether or not your local hospital is there to care for you 24/7 with an emergency department. It's not political whether or not you can give birth within a few miles of your house. It's not political whether or not you can access cancer care or you have to drive hundreds of miles in order to do that. That's not political. But what these cuts are going to do is they are going to impact communities and healthcare providers, because healthcare providers are going to have to make difficult decisions.
Yeah, and I agree, Adam, with you that, as we look around the landscape, whether it is in conservative community like mine, or if you go to a liberal, more liberal areas of our country, healthcare in those particular regions, in those areas, are still serving the same demographic of population, even though we have a higher number of Medicaid patients. We're serving them across the country, and that's why we have to look at this from a different lens of R versus D, that it's about individual care for that patient. Yes, while the Medicaid program itself may not go away, the funding to hospitals and or private practitioners will be reduced. And so when I say that, Laura, let's talk a little bit about, do we have any preliminary numbers about what that could mean? We're talking about $880 billion, but even moving 1 or 2% for hospitals that are very rural. There was a recent article put out in Becker's Health, and we'll get that listed as well, in which it says over 600 hospitals are at risk of closing, hundreds at immediate risk of closing. Others, the Office of Budget Management, Congressional Office, of Budget, is saying things like, there's really no other option out of that budget but to cut Medicaid. So let's talk a little bit about what would that look like. Do we even know?
Well, we've done some modeling about what would happen to Michigan specifically. So, for example, if the federal government decided to change its support of Medicaid for Michigan, Medicaid since its inception has been a state and federal partnership. Hospitals must contribute at least 50% of the um, amount that they are spending on Medicaid. In Michigan's case, I'm sorry, the federal government must contribute at least 50%. In Michigan's case, they contribute about 65% for traditional Medicaid. And that number is higher for the expansion program we were allowed to do, which in Michigan is called the Healthy Michigan Plan. I also want to mention, just in terms of a few numbers, Medicaid is the coverage for almost 1 million kids in Michigan. 970,000 children were enrolled on the latest data that we have, and there's no reason to believe that that's changed by much. It's very significant.
Yeah.
But if they were just to move that number around a little bit about how much the federal government contributes, and again, the state must always be a part of this and contribute its required amount, but just moving those numbers around a little bit could cause the state of Michigan to need $1 billion new general fund dollars to keep the program as we have it. $1 billion investment, which wouldn't bring any new services or expansion. It would simply be to do what we're doing now. And Michigan's general fund, that would, our general fund total, Adam, what is it right now? Like 14 billion total? That it's almost 10%. It's almost finding 10% new dollars. And, as much as I would like to think everyone would jump up and say, yes, let us help, I don't think that anybody is going to vote for in our legislature, nor many people would support the concept of a $1 billion increase in revenue for the state of Michigan through taxes. No. So it's a huge percentage of what Michigan's resources are, and there's nowhere to identify that in terms of what Michigan doesn't have a $1 billion excess annually in its state budget. I promise you that.
No, it blows a hole in the state budget. And so the state either has to raise taxes on our Michigan citizens, or they have to cut providers. And JJ, I know you oftentimes talk about all the difficult decisions you have to make on your service lines, right?
Yeah. Very difficult decisions. Are we going to close division because it's a loss over years? Do we look at it as a community benefit? We've kept our psych unit open for years when it first started with significant losses. And that's a significant hit to the organization. And hospitals like Hillsdale, who operate on no margin, right? Medicaid, to cover the cost of doing business prior to the last, year, Medicaid wasn't even covering the true full cost of delivering the services to our community and reimbursing the hospitals. So we tried to make it up on the other side. And if you look at Medicaid as a comparison to commercial insurance, there's a higher number of Medicaid patients in Hillsdale County than there are of of commercial insurance. So higher number of Medicaid versus commercial insurance. You're not going to make it up. You're not going to make it up at all. And so having the additional uplift, having the ability to, for the last year, through the provider tax, be able to fund this program to cover the cost, not make a bunch of money, but to cover the cost, has been very important. And to lose that is very significant and a concern. Rural hospitals across the country are facing this right now. Closure after closure. You see obstetrics that are closing across the country, and you hear more and more about it. Not too far from here, an OBGYN office closes, and then their OB unit closes in Coldwater, and then in community X, Y, and Z, they close. And that is a significant concern, is access to care. And the majority of the reasons that those places close is because they do not have the financial wherewithal to continue those programs. Why? Because in programs like obstetrics in rural communities, the majority of the payer mix is Medicaid. That's exactly the population that we're serving. But if they don't cover the cost of doing business, we have a problem. In the free market economy, you walk in and the guy who's changing your oil is charging you less than he pays for the oil that he has to buy. There's a problem. He's not going to be in business very long. He has to charge you more. And so in healthcare, I can't just tell Medicaid, you're going to pay me more. we have to make it work. And so to sustain any cut to Medicaid for programs like obstetrics, psych, and other programs at hospitals like ours would be devastating. And so, yes, you'll have an insurance product, right? No one's saying that Medicaid as a program is going away or that Medicare as a program is going away. But when the reimbursement is dwindling and or is cut, that an individual hospital or individual provider loses the financial wherewithal to be able to at least cover the cost of delivering that care, then those services are eliminated. And we are very concerned about the impact of this across the country. And so are many other Americans. It's not just me, JJ, the president of the hospital. Again, go to your search engine and type the words Medicaid cuts concerns on both sides of the aisle, and you'll see that many people on both sides are raising these concerns. So with that, Adam, I'm going to ask you a question, is advocacy. The individual listening to this, we're not saying we're burning the bridges and, helter skelter, but we are saying there needs to be a level of awareness. And how does the individual citizen who's viewing this today, maybe they're not even impacted by Medicaid themselves, but they're concerned. Maybe they are impacted by Medicaid. Maybe it's a Medicare, Medicaid product. Maybe it's a straight Medicaid product. What is their next steps? What should they do? How should their voice be lifted up?
Well, JJ, I mean, we're all impacted. Even if you have commercial insurance, you're still impacted because when these cuts hit your local healthcare provider, it's going to have an impact on your ability to access care.
Sure.
We need to get involved, right? So what we need is folks need to contact their congresspeople and let them know, hey, I am concerned about these level of cuts here. I am concerned about what this means for my local healthcare providers. I'm concerned about what this means for my local nursing homes where my loved ones are. I'm concerned about what this means for my ability for my loved one to access their cancer care, and reach out to your offices. It's easy to do. I know it sounds intimidating because reaching out to a congressperson sounds like a big thing. Their emails are on their website. You can send them an email. It's very easy. You can call their office and just outline of, hey, I'm concerned about what this means for my healthcare provider. Because, I mean, as Laura, as you know, when these services come offline, it's not just Medicaid patients who can't access them. It's everyone, right?
Right. Yeah. When a hospital closes its labor and delivery unit, the place where people go to have their children, it's closed. It's not closed for people who are covered with Medicaid. It's closed for everybody. And I actually had this experience. People say, well, this is why Medicaid matters to everyone, regardless of whether it's the coverage that you use or not. Perhaps one of the best doctors I've ever had a practice that was her patients were heavily skewed towards Medicaid coverage. And over time, it became impossible to pay the bills with the substandard reimbursement that she received at the time. And her practice closed. And it didn't close for people with Medicaid coverage. It closed for me too.
Yeah.
And someone who was very blessed with my employer-based coverage and my ability to cover my own copays and deductibles, still gone. And to my knowledge, she's never gone back into private practice. So that's just a microcosm of the things that we could see if funding is taken away from our Medicaid program. And again, don't be persuaded that cuts to funding or the way Medicaid is funded or any of those kinds of statements are not cuts to care. Because if hospitals don't have the resources they need to deliver care, it won't matter that you have, quote, coverage, because you won't be able to get that service, or you might be able to get that service, but you'll drive that much further. One thing, JJ, I think you could probably explain this better than I. Hospitals support physician practices from the perspective of you need a place to admit patients.
Yeah.
If hospitals stop delivering babies, it probably also dries up the pediatric practices that are nearby.
Sure.
And so it's one thing if you would say, well, I had a couple kids, I had to drive an hour and a half to get to where I was going to deliver the baby, but we planned ahead and we knew how to do it. So once every 9 months or every couple of years, whatever. But if you need a pediatrician, you need a pediatrician, especially in the first year of life, every couple months.
Yeah.
You need a pediatrician to be nearby if you have a child who's ill. You you don't want to put your kid in the car for an hour and a half to get them to a pediatrician, and then some, as we all know, sometimes you have to turn around and go back the next day or a couple days later.
Yeah.
It's a huge burden on families, and that's the kind of thing that's at risk when hospitals have to close services. There's a rippling or domino effect.
There is. And in those respective communities, even when, the neighboring county next to me closed their OB unit, it's a capacity issue for me, right? I have only a certain number of OBGYNs. And so, taking on 400 or 500 additional deliveries has significant impact to me. And some might celebrate that and say, oh, it's more volume. It doesn't necessarily always equal more revenue. It means that we're taking the same demographic of population of Medicaid, which traditionally had not covered the cost of doing business. And so the shift now goes to those respective hospitals. The other issue is if you look at closure and you have to go to a tertiary hospital, let's say Hillsdale and surrounding areas were to shutter their doors. Those hospitals would have a capacity issue at U of M, Henry Ford, and then how would they triage those patients would be the question. What are they doing to get those patients in the door, and are they accepting those insurances? And so there's a tremendous amount of concern about access. And as we look at this issue, we have to look at it from a lens of, all right, how can we advocate together to keep this type of program in our communities who do not have access? And when we talk about access, the issue isn't that when we think about abuse and fraud and waste, there's commentary right now about the individual who's, in his 20s, sitting home playing video games. What we're talking about, and you often hear the nomenclature, the conversation around, well, people just need to go out and get a job and get health insurance. I want to remind you that at most gas stations around our community, they're not offering health insurance. They're under 50 employees. These individuals are working 30 hours, making $14 an hour. They qualify for a health benefit through their state, and or a supplement. Maybe it's not a full amount, but it is a portion of that. It's for the individual who is retired and has Medicaid, or excuse me, Medicaid is a secondary, but has Medicare and Medicaid is a secondary because maybe they didn't have a job that afforded them much money to save up to have another product. Maybe they don't have the financial wherewithal. Maybe they rent a house. They don't even own a home. And these circumstances exist in rural communities like mine. So, Laura, I'm going to phrase this to you. As we look at this, what is the likelihood of this legislation not happening? And I guess what timeline are we looking at this legislation?
So I think there's a couple bright spots here. One is the degree of advocacy that's happened so far, I think, has raised many questions. But we must keep that drumbeat going to extend the conversation. There could have been decisions on this even faster than they've happened, but people like those who are, in your audience today reached out and said, this isn't the case that you think it is. And, as we've all already stated today, no one wants to protect fraud and abuse.
No.
So let's make those investments to make sure that we're eliminating that, or at the very least minimizing it, et cetera. But another type of person that we might think about who uses Medicaid for coverage is someone who's in the gig economy. People who are doing services that are hired on a daily or weekly basis, and their incomes are not in a place where they can sustain other coverage.
Right.
But Medicaid fills in for them because, a healthy person is a working person. And it makes a lot of sense to have somebody have the health care that they need so that they are in the job market and staying in the job market. So I'll get to your question, which is, what's the time frame? We could see this last for several more weeks to make a decision about what would the ultimate instructions be on finding cuts and where to find them. And the federal government or the Congress right now is dedicated to cutting federal funding to a degree that is hundreds of billions of dollars, if not into the trillions. So they're looking for that right now. But there will be negotiations, and it will get perhaps dialed down. But the more that people speak up and take action, the more that helps. Helps everyone who's trying to make these decisions understand not only the impact of their decisions, but the consequences of their decisions.
Mm-hmm.
And so it could, the Congress is on a recess coming up soon. Next week, they will not be in session. Then they're in session for a couple of weeks, and then it's Easter, and they'll be back out again. We need to keep driving these messages about the damaging effects of huge cuts to Medicaid all through this period. Contact those offices when they're in the district this coming week. Contact the DC offices when they get back the week of March 24th. Keep pushing, don't let up, so that people understand, all right, fine, fraud and abuse, let's go after it. If we're already going after it. If you want to double down on that add that effort, absolutely. But keep pushing so that we can extend this conversation. I don't want to say that we will 100% avoid some cuts to Medicaid. That's probably unrealistic.
Absolutely.
But we can make a huge dent in what this initial plan was of $880 billion, at least $880 billion. That was the minimum that was set forth in the budget resolution that passed the U.S. House of Representatives.
Yeah, and in that resolution, Laura, just because you're a resident expert in all of those areas, it was a 10-year, correct, implementation?
Yes.
And so that would be phased in. It was a recommendation for that to be phased in over those years.
Yeah, the way that the Congressional Budget Office accounts is probably nothing that the rest of us are familiar with. So if they found a way to, let's say that there was one single program that they could cut that found $880 billion in savings and said, we're going to cut this, and it costs $880 billion a year, and we're going to cut it in the 10th year. So 26, 27, 28, et cetera, no cuts in those years, but in 35, just go to 35, there's an $880 billion cut. That would meet the test of that budget resolution. So you just never know how they're going to, what they're going to find that can build up to that 880. And some things are delayed for a while, so to delay the pain. But as we all know, the time passes a lot faster than we thought. Can you believe? President Obama signed the Affordable Care Act in 2010. We've had the Affordable Care Act for 15 years. Remember all of the strife about what that meant to expand that coverage and require people to have coverage? It kind of feels not too far away to me, going through that. But we've had Medicaid expansion for more than 10 years now in Michigan. We've had the Healthy Michigan Plan for more than 10 years. And I know I've taken up a lot of time. I just want to make one last point, which is when folks are talking about all of these people who might be using Medicaid coverage inappropriately or don't really need it or should be, in a job that provides their employer-based coverage, about 25% of Michigan citizens use Medicaid, so about 2.5 million people. And again, almost 1 million of those are kids. So the first 1 million people using Medicaid are not going to be working because they're children.
Yeah, it's a very good point. And so, Adam, you have had a chance to be in both Lansing and Washington. Would you identify? This is probably the biggest cut you've ever heard of to a program within a budget. And I want to be very cautious in saying that not all $880 billion was proposed to be a Medicaid cut, correct? It was in that budget, and so, but that's where Medicaid sits in that budget. Tell us, is this rise to the level of urgency in the sense that this is the biggest number you've seen?
Yeah, in my 7 years here at the Hospital Association, this is absolutely the biggest threat that we've faced in terms of the size of potential cuts here. And as Laura said, there's absolutely no reason that Congress needs to rush these through. This is they have made up deadlines here. They're rushing these cuts that is going to have a real impact on our local hospitals. They absolutely don't need to do that. We need to urge Congress to move forward. Let's use common sense, not to use a medical analogy, but let's be surgical about this. Let's go in, let's find that true fraud and abuse that we can root out. But let's be strategic, because there's absolutely no reason this needs to be rushed. And I mentioned earlier reaching out. Michigan Health and Hospital Association, on our website, we have a link that you can click. Makes it extremely easy. You click that link, it looks like it's up on the screen already, which is fantastic. Plug in your name, your address. It automatically finds who your elected officials are and automatically links you, and it even builds in language to send. I encourage you to customize it and let them know the local impact there, but we need your help in reaching out.
Absolutely. Adam, Laura, it's always a pleasure to have you on our programs, whether it's our podcast, our live event. You bring a tremendous amount of information to the table that goes far beyond Hillsdale Hospital. It's talking about healthcare in Michigan, as well as healthcare across the country. And this is an issue that impacts all Americans. And hopefully we can start to frame the discussion around access to healthcare, not political discourse. That we can start talking about what is best for our patients. How do we get there? There's always, even from a biblical sense, the poor will always be among us. How do we take care of them? We say, oh, it's a church's responsibility or so-and-so's. At the end of the day, individuals who qualify and need health insurance have a program available to them under Medicaid. Each respective state can expand Medicaid. Had a choice to expand Medicaid. Michigan was one of the states that expanded Medicaid and gave additional access to individuals. We witnessed that here in Hillsdale County. But as I close today, as a reminder, nearly 70% of my payers that walk in the doors of our hospital are government funded. These are individuals on Medicaid or Medicare who come in those doors to get their care every day. 140,000 outpatient visits last year, 20,000 people through our emergency department, 415 live birth deliveries. And the list goes on and on, serving those patients, psychiatric inpatient beds, providing a place for patients to go who would otherwise be boarded in an emergency department or not properly taken care of. This is providing back to our community as a non-for-profit, locally owned hospital. We lift up our voice today and say we've got to have a civil discourse about how to fix this, how to address the need for this population in our community to continue to have the benefits to seek the care that they need, and to be able to give those payments to hospitals to be able to sustain the work that they're doing. And that is critical. And for primary care practitioners, whether they're hospital owned or whether they're independent, those dollars that come in from Medicaid help cover sometimes just a fraction up until the ACR, but a fraction of those costs to deliver care. And we must unite together with our voice to let our elected officials know that this is one area that we want to preserve. So I want to thank you today for joining us. It's been a pleasure. I'd like to get you back on the show if we could.
This is kind of just about all we're thinking about for the next several weeks. So yes, we'll be available.
Okay, that's perfect. Well, thank you again. And thank you to our listener for joining us. It's support like you give us that makes all of this possible. It's a support you give our hospital. If you're looking for ways that you can volunteer, if you're looking for ways that you can join Hillsdale Hospital, if you can join the fight to preserve healthcare in our communities, go to hillsdalehospital.com. You can nominate a hospital staff member for a patient award at that location. You can support our capital funds. You can learn about what can I do in healthcare? If I want a job, will they fund me? Will they provide education to me? And we'll do all the above. Absolutely. We'd love for you to join our winning team, winning workforce right here to keep this local hospital, third largest employer in the county, second in the city, contribute back $1,055,000 last year in community benefit. Imagine if the third largest facility employer in the county contributing back $1 million alone just in community benefit, creating jobs in the hundreds did not exist. We only have to look to Albion, Michigan and see what happens to a community where that happens, or other communities across the country. Kirsten put up earlier MHA and website, go to those places. She put up Becker's, read about what's happening across the country with hospital closures. We must listen today, we must take action, and we thank you, our faithful listeners, for engaging us today in this discussion, and we look forward to having additional conversations. You can always tune in to WCSR 92.1 on Fridays, also Buzz Online 102.5 on Saturdays, and to learn about all the happenings in healthcare, similar to what we're talking about today. We are going to tackle the issue of Medicaid on the radio program. We'd love to have you join in also on our national podcast, ruralhealthrising.com. That airs every Thursday. And then we're going to be announcing a new podcast in the very near future, but I'm not allowed to say what that is yet. But that's a little teaser for you. We'll see you here again next Wednesday. But until then, stay safe, stay healthy, and stay Hillsdale strong.